Phil Lindeman, Krystal Media News Director, with the latest on Summit County's public health order. On April 22nd, the Summit County Board of County Commissioners met to review a draft of the latest public health order, following the state's safer at home restrictions and guidelines for the slow, phased return of industry and everyday life. Here is the meeting, unabridged.
We have the three commissioners present, so I can call the meeting to order. And Scott, are you not going to be running the meeting at all?
Yeah, I'm going to let Sarah keep control of it so we don't go back and forth with one another.
So, Sarah, you have an agenda.
I do. So first, thanks to everyone for joining and for your interest in this topic. I think as I've seen through all the emails and the calls that I've been getting today, there's a lot of confusion about the public health order and the changes outlined by the governor. There's a lot of strong feelings about what we should do here locally. So this is the venue for our Board of Health, which is also our Board of County Commissioners. So Elizabeth Lawrence, Karen Stegelmeyer, and Thomas Davidson are going to better understand what the recommendations are of our public health director, and then at some point make some decisions about how the governor's changes impact us here locally. I will say that Amy talks a lot about the dance that we're trying to do here between, feels like walking a tightrope more than a dance, but between keeping our public safe and well and not allowing for an alarming spread of this dangerous virus, and also understanding that the public health order has crippling effects economically on our community. So the feedback that I'm getting from the public is either please don't open at all, this is a dangerous and terrible time, all the way to the things that you're talking about or considering are way too strict still, and our economy needs to bounce back and get going again. So again, very tough job for our Board of Health to make these decisions, given all the strong feelings that are both all very valid. But again, I think we're going to talk a lot about data and trying to use data to drive our decisions in this. So let's see, I'm going to go through the agenda. Amy, do you want to talk just at a very high level about the testing that was done with Vail Health?
Sure, happy to do that. Good afternoon, everybody. We had a very successful day with Vail Health yesterday. We had 48 folks sign up for testing, and we only had one no-show. So 47 tests were completed. We also still were running our stadium testing yesterday. We currently have 66 tests pending for results, and we're hoping to have those results start trickling in overnight and throughout tomorrow. Because there was such a need yesterday, Vail Health is doubling their capacity for testing tomorrow. I'm not sure how many appointments they have filled yet, but it's really great that they were able to increase their capacity right away as they saw the need. We also did hear
I would have to upgrade my Zoom account, which we can't.
We also did hear from them that it was their busiest day ever since they've started testing. That includes all their days in the field. So that was pretty
Lori,
interesting.
So it's interrupting what Amy's saying. I think that's Lori talking.
Yep,
go ahead, Amy.
Yeah, let me interrupt for just a second. So apparently we have hit our maximum Zoom participant number of 100, and there are other folks that are trying to participate in the meeting. So I guess what I would ask is, Lori, are you able to record this meeting so that we can play it afterwards for any folks that weren't able to get in to the first, as the first 100?
Yes, I can record it, but not if we break out into another group later, it will continue to record.
Okay, that's fine. We'll do our best to avoid any kind of a breakout. But that will at least allow those folks that are not able to get in right now to be able to listen to this after the fact. Jeff, any other comments with regards to that? This is a situation that we haven't experienced yet.
Jeff, you have to push star talk.
Sorry.
Oh.
No, I think that it's the best we can do under the circumstances is record it and make it available to the public in the future.
Okay, and Krystal 93 just informed me that they're also recording. So that's great. Thank you. I assume maybe that's Phil. So, all right. So go ahead, Amy. I just wanted to make sure that everybody knew kind of what was happening.
Sure. I was just to repeat myself. We had 47 tests through Vail yesterday. Because they were at capacity for the amount of staff they had yesterday, they quickly realized they need to increase capacity for testing tomorrow. So they're doubling their capacity. They did mention that yesterday was the most they've ever tested in one day, including all the time they've been testing over in Vail. So I think that that was really telling in terms of how many people in our community are experiencing some sort of respiratory symptoms. Of course, that's no definitive information regarding whether they're going to be testing positive for COVID-19, but we will get the results of the tests hopefully starting overnight and trickling in throughout tomorrow. And we also continue to do our stadium mobile testing as well. So we have 66 pending tests currently. Our numbers did not change between yesterday and today. We still have 101 cases. And I think that was your main question, Sarah, was just an update on the testing. We do have Centura coming hopefully on board maybe by the end of the week. We are still waiting on details of how that will roll out and what their days and times of testing will be.
And I do have an update on that, Amy. I spoke with Lee Boyles just a little before this meeting, and they are going to be doing 7 days a week, 9 a.m. to 2 p.m. Monday through Friday, and then Saturday and Sunday, 9 a.m. to noon. They are going to put a press release out, I believe, this afternoon. So then we and the public will have more information about what their plans are and how people access that resource. So great news in a very short, well, just from last week to this week, the change in capacity for testing is incredible, and we're very grateful. I thought I'd just go through the quick updates, and then we can talk about the public health order because that's going to take the longest.
Sarah,
Amy, can you?
I just have a question regarding the testing.
Sure.
So on that, with the increased testing from Centura, Vail Health, have they said how long they will continue to test here in our community as well?
All that they've said is we will take care of you and we want to support you. And so I think it really depends on the demand. Lee Boyles did say today that they had the intention to do this for the long haul. And so to keep their 7-day-a-week testing up in our community for as long as we need it, which we believe will be, a very long time, at least a year probably. So again, we don't have a set end date from Vail Health or from Centura, but I think both entities understand that this is just the beginning of the testing. And in order to continue to open up the community and then keep the community safe, regardless of how open we are, we have got to have that capacity. So in other words, I think based on the commitments verbally that we've gotten from both entities, I think we're going to have this in perpetuity going forward. Okay, so Amy, can you briefly just cover where we are with tracing and surveillance? And I know when we talk about those triggers, and a lot of people had questions about, what are the elements that have given us thoughts about reopening to some degree. And it's that testing capacity, it's enhanced surveillance, it's capacity of the healthcare system. And so just sort of giving people an understanding and reassurance about where we are with those pieces. So if you could just talk about surveillance and contact tracing, that'd be great.
Sure, there are criteria that help guide us in these decisions. First, I'd like to make sure everyone knows how grateful we are for the sacrifices that were made in terms of the extreme social distancing and following the order. We are fortunate to be in a place similar to Eagle where we really shut down where we really shut down things right away and decrease the population to our residential population made a huge difference for us. We believe the percentage of social distancing that we've been experiencing is much higher than the state, and some of the social distancing measures actually rate us as that as well. So that was one way of measuring, but the criteria that we really look at for moving to the next phase of taking a small, very small step forward into reimmersion and on our way to a new normal include our ability to increase our testing, to have testing, to be able to perform testing of anyone with COVID symptoms right away so that we get those results and we're able in public health to do our job with surveillance and monitoring. And that includes identifying those who are tested positive and issuing isolation and doing contact tracing and issuing quarantine orders in an effort to really contain the spread of the illness. It's important for everyone to know that this illness, this disease is going to be with us for months to come, 18 months or longer before we may have a vaccine. It might even take longer than that. It took 4 years for our scientists to come up with a measles vaccine. So it's really important that people have a realistic just concept of what we're talking about here. And now it's about learning how to live with this disease that's endemic in our community right now. And we will have increased cases as we move forward in getting our economy back on track. And it's a matter of really finding that balance of where we can do that in a safe way. We will continue to have folks becoming ill and likely may also have some with poorer outcomes. And it's a matter of protecting those most vulnerable in our community while taking some steps a little forward. So that's a little bit of our surveillance and contact tracing. The other pieces that are really imperative are to make sure that we're not in a place of overwhelming our healthcare system. So ensuring that the hospital has the capacity to operate and not be overwhelmed to where we're getting into a crisis standards of care situation. And that's not just regarding the ability to care for COVID patients, but also non-COVID patients in regular operations. And then, making sure that we continue to have clear protocols in place with our order as we start to lift certain measures, but making sure that they're done with really great guidance and restrictions. Face coverings will be a huge part of our existence for the next several months as we continue to try to keep this disease spread at bay.
Thank you very much, Amy. Brian Bovaird, are you on the phone? And could you do a quick What? Brian, could you do a quick update on the temporary deputy emergency manager for the board?
Hey, Brian, you're muted.
There we go. Is that better?
Thank you.
Thanks,
Yeah.
Elizabeth. So we'll put in for a temporary emergency manager, deputy emergency manager position for roughly the next 3 months. And the reason for that is with the continued response and in addition to the recovery and reimbursement, and in addition to all of the daily activities that I'm responsible for that I'm not able to get to now, bringing somebody in with a background in emergency management and some training and experience to let them really work side by side with me on COVID response and recovery will allow me to then pay better attention to the things that I need to be paying attention to that I would normally otherwise be doing, such as spring runoff and wildfire planning and prevention, and especially one of the things that I need to work with the Red Cross on is completely revamping our sheltering model in anticipation that we can't do a congregate shelter for really until there's a vaccine in place. And you just heard me say that could be, easily 2 years. So, in essence, my one-man shop has become completely overwhelmed. And while we've been able to supplement it pretty effectively to this point with other county staff, the addition of somebody with some experience and training will be greatly welcome.
Thanks, Brian. And when do you hear back about that?
So I believe that the position is getting posted this afternoon. And also, I guess one other really important note is that this position is an eligible expense for reimbursement from FEMA public assistance. So as an unbudgeted temporary employee, the 75% of this position's pay will be an eligible expense for reimbursement.
Thanks. So then just a quick update for the board as well that in terms of county operations, we want to make sure that we're responsive to the community in terms of any offices of ours that are closed that's creating difficulties for folks, but we plan to do our best to model remote operations at a very high level as we've already been doing and maintain as much of that remote work as we're able to. So board members, if you have any questions about that, let me know. But I think our goal is to try to stay as close to what we've been doing and working remotely to just keep our employees and the community safe. Do you want to do a quick finance overview, Marty? Just kind of a high level impact, sort of what you talked about this morning.
In terms of for the county's finances, I'm sorry, I'm not sure what you're asking me, Sarah.
Yes, well, it was on the list that Scott gave me.
Okay.
Like a quick finance just for the county.
Gotcha. Sorry. Many numbers running through my head right now. Yeah, so I did some revenue projections for the county. Again, these are obviously very much guesstimates because we don't know what's going to happen and how long things are going to be shut down. However, in looking, sorry, I'm trying to get it open here. It looks like based on the projections that I have going, and the biggest unknown is the sales tax, but it looks like about a $3 million hit to our general fund. The next highest impact is our transit system, which is about $2.5 million impact, and that's accounting for the $1.8 million assistance that we may get. So it's really closer to a $4 million hit to our transit fund. Some of the other funds, our affordable housing fund, which is also very heavily sales tax based, about $620,000 impact to that fund. And then many of our others are property tax based. And so as long as we get in all of our property taxes, which should happen by the end of the year, most of those other funds won't have a huge impact. One other fund of note is our solid waste fund, the landfill. Again, big decrease in volumes for them. So that's, again, sort of a guesstimate of when that might pick up again. But right now I'm looking at about a $600,000 impact to that fund. Do you have any questions on any of that?
I'm going to give board members 2 seconds to unmute.
Well, I guess I would say what I've been trying to be positive about. Happy Earth Day. We've succeeded in having clean air and less waste. That was one of our goals. But this is pretty shocking, Marty. I did have a question for Brian in terms of, I think this makes sense. We absolutely need more assistance there. but what are the chances we can actually find such a person?
That was my same question, Karen. I didn't know if there was someone already in mind, just because that seems such a specific skill set.
Well, commissioners, as a well thought out emergency manager, I have scoured the western slope, and yes, I have identified at least one person who meets all of the criteria that I have set for that position. And so with just a little bit of luck, I will be able to officially convince this person to take this temporary position. So yeah, and if that does not work, then yeah, I will continue to actively reach out to try and find the really diamond in the rough that is someone who has the experience and the knowledge and has not either been scooped up already or already in full-time employment. So I have one very, very positive lead and one other potential.
This is Thomas. I think that getting that person is a good idea, Brian, and I'm okay with you pursuing that. Marty, with regards to these projections, when would you have them in a form that the BOCC could actually take a look at and review all of the assumptions to just better understand?
Thomas mentioned that there's a work session next week where we're going to take a deep dive on this stuff.
Yeah,
On the
Tuesday's
finance.
my goal.
Thank you.
As well as looking at our expenditures in places, we've delayed a few capital things, but other places we might be able to save some money in the budget as well. So I'll have all that stuff for you Tuesday.
Thanks, Marty. So we had the first Community Recovery and Resilience Committee meeting. The days are all mixed up, of course, so I think that was yesterday. Bentley is running that. There was great participation. I think we're struggling with, again, wanting to make sure that every sector of the community has a voice and gets to be part of that, but also not having something that's so unwieldy that we can't make decisions and function. Bentley, do you want to just talk quickly about when the next meeting is and some of our focus there?
Sure. Our next meeting is set for Monday, and this is going to be a little bit broader audience. We're going to go ahead and try to reach out in a town hall style meeting to talk about these issues and to try to engage on a broader basis. As Sarah said, we have a great representation on our Recovery and Resiliency Committee, and we will be continuing to reach out to them. The intent of that committee was to try to define and identify local subject matter experts in areas that are across all economic sectors of the county so that we can ensure that as we begin our recovery and as we start moving forward, that we are understanding what the needs are of these various sectors and understanding what kind of nuances there may be in terms of how we accommodate those various sectors. So we're excited about moving forward with this. We're excited about getting the broader community engaged next week. We will be getting some messaging out regarding that meeting, and just stay tuned for that. And we'll try to engage on a little bit broader basis to make people aware of what it is we're trying to accomplish and how we intend to continue to move forward.
So Bentley, a question on that. Will we have committee members from that recovery committee answering questions then? Will they have a heads up of what those questions are? Or I guess when I think of town hall style meeting, I think of a lot of Q&A instead of maybe us preaching out to people. And so I guess I'm just trying to understand the format of that a little more and how or if our community is going to be asking questions.
So those are some of the details we're still trying to iron out, but Commissioner, we will be asking some of our committee members to weigh in on their area of expertise and talk about how maybe certain things or certain activities within, say, the restaurant association may be best managed and handled in order to get those folks back up and running. And we'll look at some other sectors and reach out to a subject matter expert within one of those as well to talk about how that one will maybe need to be nuanced and managed in order to get it going. Obviously, our new public health order is going to talk about retail space. We may actually ask some retailers how we go from, say, curbside to the next step in order to accommodate a greater level of traffic and additional interaction with our community.
Great. And I don't want to get involved in the operation of the meeting. That's not what I'm suggesting. But, I'm having a really hard time paying attention to this meeting because I'm getting so many requests from people that are trying to get on our current meeting that can't. Continuing, my phone is ringing off the hook. And so I just want to make sure that our meeting on Monday, that we'll be able to accommodate whoever wants to be a part of it. So it's my only.
Will do. We had anticipated it being a pretty big group, so we are going to take steps necessary to make sure we can accommodate a big number.
Thank you.
Great. Thanks, Bentley. Just a couple other quick updates. Our neighbors in Clear Creek have an urgent need for PPE. They're looking for surgical gowns. And as we know, there's shortages of PPE all over the state and the country. We, for some reason, have that's the supply that we have the most of. I think we have 9,000 surgical gowns is what Brian told us this morning. So it was our hope to share, Brian, correct me if I'm wrong, but 600 surgical gowns with our neighbors to the east. As we've seen, our neighbors to the west are coming to our rescue. And so we would like to be able to do the same for Clear Creek if we can.
Sarah, the total number recommended was 3,000, and that would bring us our total stock of surgical gowns to 6,000. And then that 6,000 gowns that we would be left with is still significantly higher than the amount of any other PPE that we have on hand, like N95s or gloves or anything. So in my calculations, it certainly is not leaving us out to dry as far as a critical PPE need. And furthermore, that was part of a shipment from the Strategic National Stockpile. So in the grand scheme of community and neighbors helping neighbors, I think, they're certainly entitled to that equipment just as much as we are, and they clearly have a demonstrated need right now. So yes, I certainly recommend that we do give them those 3,000. That would greatly help them out, but also not put us in any kind of precarious position with our supply.
Great, thank you. Scott also wants to let the commission know that we got a note from Eagle County's county manager, and they're planning to ask I-70 or CDOT to put VMS boards on I-70 that essentially say something like travel into Eagle County restricted or limited to residents and essential business only, including lodging, trails, and open space. So the idea that they're just throwing their doors open to the world is not exactly what I think they're wanting to communicate. So Scott did mention that and said we could maybe talk with CDOT about a similar messaging for us, so that as Eagle County opens more than we do, particularly because they do have all their lodging still available, that might help with surges of people coming into Summit that would be difficult for us to manage at this point. Any questions about any of that?
Well, Sarah, if you can just expand on that, because I have had a number of questions, and I do see some people, River Ridge Rentals, for example, on this call, and I've seen a petition that some lodging companies have sent around that we've got to open up Summit County tomorrow, get it all open. And so can we talk, because they're referencing Eagle County's open, why are we not open? And so can you talk a little bit about the differences, or maybe Amy will? I was on a call with their public health director earlier today, and I think he did a really good job explaining that. And so if you can talk about how they're not really open to tourism, or are they, and what that means.
You want to start with that, Amy?
Yeah, I'm happy to talk about that. Yeah, I think that the word reopening, I think, creates a lot of confusion. And I think what's most important for everyone to understand that this dance that we're talking about is really small steps forward over a long period of time. And it's a phased-in approach of what we can do to have the balance of starting to bring the economy back a little bit while maintaining health and safety of the majority of our population. And I think it's really challenging. We've talked a lot about that here, and keeping our short-term rentals closed through the end of May so that we can really do that small step forward approach. And that is what Eagle's intention is as well. And I think I do want to talk a little more about how much a little farther along they are in terms of what they've been able to do from the beginning. It's important to understand that each county is going to be a little bit different given their characteristics and the level of community transmission and the capacity to implement the strategies that are really important and ideal for making these stepwise approaches to reimmersion and getting to that new normal. But it has to be done slowly, and we have to continue to see that we're not overwhelming the healthcare system, and that we're able in public health to have a strong infrastructure in place to do that contact tracing, that we're getting reported by providers, we're getting reporting back that it will allow us to, again, isolate and doing isolation and quarantine orders and contact tracing. But Vail Health in particular, they're an independent health system governed by a local volunteer board of directors, and that really enabled them right away as a health system to put the community as a number one priority. They could make their decisions quickly and easily, and they began doing testing right away. They began actually stockpiling tests way back in January as a health system. And so it's really important to understand, and they actually have tested more per capita than any other city or county in the country. And so they do have a huge amount of data to make decisions off of, and they have over a 2-week period of time, which is one of the criteria, is to really see over a 2-week period of time a steady decline of positive cases. And so we're hoping with the testing now that we have implemented that we'll be able to see that. The other pieces about Eagle County that are different than us is we have 3 times the number of short-term rentals than they do. And even though they never close those down, they're really trying to discourage folks from coming up unless it's a necessity to be there in the community so that they can continue to evaluate and do the surveillance needed in the next couple of weeks as they do open up in that stepwise fashion to see what the illness is going to be doing after that, because we do know that we'll see an increase in cases as we all move forward. So we're all looking to Eagle, very anxiously as we are other places across the nation and the world really who have started to reopen. But it is really important to understand the differences between the two and why they were able to make this stepwise approach, but they are not reopened, which is different than what the governor had said.
I think too, thank you, Amy. Because we're all, Elizabeth is getting, I'm sure the other commissioners are as well, just bombarded with questions and concerns, both that we're being too restrictive or not restrictive enough. There's a lot of fear in our community about people coming in and bringing illness. There's people that have been concerned about workers working in essential businesses, and it's not as if we have decades of data or an understanding of what this virus is going to do. So this is brand new territory for every community across the world. And so they're very difficult decisions. And I think all of us who are just discussing the options, and particularly those of you the Board of Health and Amy, who are in decision-making positions, it's just very difficult, again, to have that dance between the public health safety and then the economic devastation that everyone's experiencing. So any questions on that stuff?
I
I'm
was on the health, the CALFO public health call today, and it was really helpful to see some of the charts and the criteria. And I think one of those, Amy, that you're familiar with has the criteria, and has, I think it was Eagle County that came up with the green, blue, and black. So green is some lessening of restrictions, and then blue is 4 weeks later, maybe it's even more opening and less social distancing. And then the black is not quite normal, but where we get to where we can have maybe 50 people again. So I think having that in a chart form was really helpful for me, and could be helpful for the public to see the criteria, what we're looking at, and how a staged lessening of restrictions could work.
Yeah, we
thank
could
you,
we
Karen.
could certainly share that.
That might be a good thing to put on our website, so people could access if they want on our COVID page.
I think we're going to make a couple of changes to that document just based on that call. But all in all, I found that to be the most helpful thing I've seen in this whole 6-7 weeks. And I think because it was so visual, it was broken out in these bullet points. And I really appreciate kind of we're in the green and then move to the blue and then the black diamond, etc. I just think that translates well to people in our community.
Great. So I'm hoping Jeff Huntley is on the phone and can unmute by pressing *6, Jeff, because Scott does a lot of this process stuff, and I want to make sure that I'm doing this properly. But this is a work session, and so I think I inaccurately said that the board would make decisions, but I think that has to happen in a regular meeting, and this is a work session. Is that right, Jeff?
Correct. Correct. There wouldn't be any decision making today. This is informational only as a work session, and so
Okay.
yeah, typically the board does not take comments, but people. I'm assuming if you could give those who are listening an email address where they could send in any questions that they might want placed before the board's consideration or staff's, that would be a good thing to do.
Oh, that's a good idea. So you can send any concerns or questions, and I've been getting them all day, to covidquestions at summitcountyco.gov. And there is an S on the end of questions. So covidquestions at summitcountyco.gov. So I think what we want to do now, and again, Jeff, jump in if I'm doing this inappropriately, or board members, if I'm missing something, please correct me, is just kind of go through, everyone's seen the recommendations that Amy's putting forth in terms of how we would potentially amend our public health order to be in tandem with what the governor's doing. There are some differences. So I think now is when we would sort of discuss concerns. The board gets to ask questions or voice concerns about elements of it, and we have that discussion. I can certainly share some of the things that I'm getting from the community as concerns. And then I know you had a big list as well, Elizabeth, of people that have reached out to you. So not sure if you want to just dive in and start with pieces that, if it's something with the public health order that you don't take issue with, I don't think it needs to be discussed. That can stand. But if there are pieces that you want us to explain, or you want to have more conversation or discussion about, we should address those. Is that right, Jeff?
Correct.
Okay. Correct. All right. So I guess I'll put it to the board. How would you like us to start or frame this discussion?
I guess we could go through that list of recommendations one by one that we put out kind of based upon the state recommendations.
Great. I think I'm pulling that up now. So you want to just go through each one?
I think for full transparency, if we discuss each one of those, because our governor did go into more detail on some of those at a 1:30 press conference this afternoon.
Sorry, Elizabeth, you were cutting out a little. Were you saying we should go through each one?
It's just a suggestion for best transparency if we went through all of those, because our governor covered that too. Yeah, there's a phone not muted, sorry.
Yeah, I know, it's creating feedback. Please mute your phones.
Sarah, this is Thomas. There were also some questions that we were trying to get some follow-up answers from the governor's office on. And so I think going over those details and whatever additional information you were able to collect.
Oh, goodness. I don't know, Lori, if you can mute everybody again. Thomas, unfortunately, haven't gotten a lot of information from the state. So I think you're referring to, sort of the idea that this would be open only under stricter guidelines, and we're waiting for the stricter guidelines. We haven't gotten information on that yet. So there were a lot of questions and concerns, particularly, for example, about childcare centers and what that would look like. And this is an example of when those messages come out from the state, and then locally, there's a bit of a panic amongst all of us about how are we going to operationalize this, and really what is the guidance that we're supposed to be providing. So no, we haven't. All that we've gotten is the same thing everybody else has gotten, which are the two press conferences yesterday and today. And so we are anxiously awaiting more guidance from the state so that we can use that to inform the decisions that you all are going to make in the next little period of time. Right, Amy, did I get that?
Yeah, the stricter guidance or precautions are really going to be specific to that type of business. And so we have had pretty good guidelines on childcare before it became only for essential workers, children. And I don't know if it's going to deviate much from that already, but again, all the specifics for all the retail stores as well as the offices and such, all of those strict precautions are to be released from CDPHE over the next couple of days and even the weekend, I heard him say today. So we are all eagerly awaiting those. We have lots of guidelines available through Johns Hopkins and CDC already that we can at least start to think about. But again, once we get the restrictions from CDPHE, we might even add additional restrictions such as requiring face masks, for example. So we won't know until we see those guidelines what will make sense for us here locally.
So if we're going to receive some of these over the weekend, will we be prepared to then put out our own recommendations and implement them, et cetera?
Elizabeth, I think that's a really good point. And we might want to delay some of our implementation of the order for an extra week to give businesses and the child cares and others time to implement the strategies, work with our staff in answering questions and making sure that they have what they need to open safely.
Okay, so I will start going through the list, and maybe stop me if any of you three have questions or concerns about any of the items as we go through them. So the first is people older than 65, sick people, and people with underlying health conditions must stay home as much as possible. That sounds more like guidance than a rule or a recommendation, because it does say as much as possible. Any questions or concerns about that one?
I would just reiterate that our governor did spend a good amount of time on this today during his press conference, and there was a question about 60 versus 65, and that still seems to be unclear which one it falls under. And so we probably need to make that decision for us here in Summit County if we're recommending age 65 or if we're recommending age 60. And he did say that it looks like that will be implemented for a long time here to come. And so also, as we think about how does our senior center pivot, I guess, to meet the needs of those members of our community.
Amy, do you have any thoughts or recommendations about the age, 60 versus 65?
Well, I recommend that we'll be consistent with the terminology that the state ends up identifying. So we'll look to that in the next day or so and see what we can find. But we've been saying 60 or above for the last several weeks. So that's what I'm thinking that we will stick with. And this also includes those with underlying conditions. That's important to understand as well going forward.
Great. Thanks, Amy.
This is just getting into messaging, really, but it seems like a couple things. One, there are a lot of people in our essential workforce who are over 60 and over 65 as well, but probably more in that 60 to 65 age range. It just seems like we need to have 2 bullet points, the older people and then people with underlying health conditions. So you might be 50 and you need to stay home. I have had a lot of input lately about, people who are desperately working and really need that paycheck so much that they are not going to stay home when they're sick. And I think we need to have some careful messaging about just take care of your family, stay home, don't go to work. But anyway, I think if those were separate bullet points, we could focus on the older and the underlying health conditions separately, because we've gone back and forth, I know, in many discussions about 60, 65, nobody knows. But if you have underlying health conditions, then stay home.
Right. So maybe the attorneys and Amy, we can work on wordsmithing that as we're putting all of this together and bring something back, some kind of recommendation to the board in terms of that piece. Any other questions or concerns about the first one? Okay, next is gatherings of more than 10 people are prohibited and people must maintain a 6-foot distance when with others outside of their immediate household. How are we feeling about 10?
That's a state recommendation. So we only have the option, I think it's important to explain that, we only have the option of being more strict than that, unless we were to ask for some sort of exemption, I believe. And correct me if I am wrong on that. So I would say, because the state is at 10, we should stick with that.
That's a great point.
Unless, Amy, you feel that we need to be more strict.
No, I think less than 10 makes sense. It's consistent with all the guidance that we're seeing, not just with the state, but other documents as well that we're relying on for our information for our plan. So yes, I agree.
Yeah, and that's a great point, Elizabeth, just to remind people that the only way we could vary from the state public health order is if we put in something more rigid or more restrictive than the state, and then that would trump what the state's doing. Okay, so the next one is non-essential retail businesses will remain closed, but can continue to take orders online or over the phone and provide products through the mail.
This is one that I really struggle with because I think we have a lot of small businesses, Main Street businesses, that could do what restaurants have been doing, appointment only visits, or be able to provide not through the mail, but at the door, like we're doing with food. And I'm a little confused about this one. If this is, can we be less restrictive on this one? Because I think there are a lot of our small business people who are anxious to get going on a step-by-step, careful basis. And I would like us to be able to make that work if it can be done with the right protocols, the right cleaning, the right distancing, and all that, which we're already doing in other stores. So it seems like our small businesses could do that.
I think, Corinne, that's a great question. And I know that that's one a lot of people have taken this small step forward to allow curbside pickup is really an important one to go through before we really open the doors. I think one thing that was mentioned earlier by Bentley, and one document that we're going to try to get online soon by the end of this week, hopefully with the supplemental guidelines on how to disinfect properly, is something called a social distancing protocol. And this is something that businesses will have access to. It's something we're going to start requiring as we move toward a new normal. And it might be several weeks before we get to that point, but at least this allows businesses to start filling out a document that really goes through all the different components that we're going to need to feel comfortable with allowing patrons into an establishment. And this includes, how are they going to ensure the health and safety of their own employees? How are they going to go about disinfecting? How often is that going to occur? What are they going to be utilizing for disinfecting? It includes what, how are they going to maintain the 6 feet of separation, requiring face masks both for employees and patrons? How are they going to enforce that? So I think it goes into all of those components, and this is something we'll start asking businesses to look at and start thinking about how they're going to be able to open up and do things safely. As we move toward these steps, it's really important to emphasize the personal responsibility. These protocols will be required to be posted within their establishment so that there's that creates an enforcement tool that we can follow up with if need be, if we get complaints and so forth. But I do think that this is a very small step that we need to take. Remember that one of the things for really moving in the direction of getting to a new normal is to make sure that we have, over a 2-week period of time, consistent decrease in cases. And so the recommendations that we're making today are really getting us to a point of, we're really doing the stance, which is that we might take 2 steps forward and then we might have to pull some things back. And so I think this one component, in addition to everything else that we're looking at taking a step forward with, it's really important that we just don't go too quickly before we have the data needed to guide us to do it in a safe way.
So I would really advocate, though, that we find a way or allow retail to have some sort of private shopping experience where they can have one customer in at a time or something like that, in addition to the curbside. Because I just can't understand if someone, and I'm just going to pick on a store, but if someone goes into next page and they touch a book and they check out, they're the only person in there, how that's any different than people touching all of the items in a grocery store and there's no one coming behind them and sanitizing those boxes or paper, whatever they happen to be touching. So I guess I would hope that those strict restrictions on retail or strict precautions, we could have a way that retail stores could submit their plan to us and maybe that's where we really have to also use the expertise of our local towns, since they have the contacts with all of their local registered businesses within their own towns. And so the plan has to be submitted if you're in a town to that municipality. It has to be approved to do some sort of private shopping one-on-one or something.
So do any of the board members want to make a suggested amendment to the language, or are we comfortable with that for the time being?
I sure would like to have the language say, provide products curbside, because I just keep going to the equity of our Main Street businesses competing with the big boxes that are already doing this, and the restaurants that are already doing that. It seems very safe to have curbside. Here's your little kid's shirt or whatever.
Sarah and Amy, this is Thomas. In order to do this, we would need to get permission from the state in order to have an exemption from that order.
No,
Right,
I don't.
so-
This is Jeff. I don't think so. Right now, we do allow curbside, and I believe the state allows curbside. So we're okay currently. To do something that would be more liberal, so to speak, than the state order, we would have to get special dispensation like Eagle County is requesting. So I guess that hopefully answers your question.
So if we have that ability, then I would agree, but I think that we've got work to do in terms of coming up with those protocols and knowing that we've got a reasonable chance of success if we do that. But I think that that's work that we need to do in the next couple of weeks, and then reevaluate if we feel like we've got protocols in place where we have a reasonable chance of success if we were to allow it.
Well, and in order to request permission to have a less rigid guideline, I think we would need to demonstrate to the state that we had data to support that decision. It's just a thought, but I do believe that when Eagle County submitted their request, they had to provide significant information to the state to make them feel comfortable with an exemption. And I don't know that we would be able to demonstrate that.
So what exemption would we be submitting? Because currently our governor is suggesting that it's curbside for all retail, and then otherwise it would follow strict precautions. So do you mean in terms of the private shopping? I mean, we don't know what those strict precautions are yet from the governor, correct?
That is correct.
Correct.
This is Jeff, and we are waiting and waiting. So we don't know when those might come out, but until we have a firm understanding of what the state is actually requiring versus what's being stated in the press conferences, we can't really come up with a proposed draft order at this point in time.
Right now, the state Safer at Home says open for curbside delivery and a phased in public opening with strict precautions. So even the governor, I don't think is going to allow the public opening with strict precautions until they see how the curbside pickup is going. So I think even statewide, they'll be phasing it in over several weeks.
So then are we planning though to follow along with the curbside pickup beginning April 27th per the governor?
Yes, that's what I'm recommending, that we allow curbside pickup.
Sorry. So curbside pickup is allowed. We wouldn't need any sort of exemption. That's the same as the state. Right. Okay. So more discussion or any suggested amendments to that one at this moment, or are we comfortably uncomfortable?
Well,
This is Thomas. I'm comfortable with curbside on the 27th. I think that in the meantime, to the best of our ability. And as we can get more information on the details, we need to be working with our business community so that they can at least have some sort of indication what they're going to be needing to do to actually allow a person safely into their shop as soon as we can do that. And we can't tell them suddenly one morning, oh, here's everything you have to have in place, and expect them to be able to, come up with that by noon. This is going to take lead time for our businesses. And so we're already doing it, but we will continue to press the governor's office. Tell us what you mean so that we know we're either permitted to do it, or tell us what we have to ask for in terms of an exemption if we think that we've got a good enough system of testing and contact tracing in place to ask for that exemption.
Karen and Elizabeth, are you comfortable with that?
Yes.
I just want to, sorry, go ahead, Elizabeth.
So yes, I'm comfortable with following the state order of April 27th for curbside. I wasn't sure exactly what we're answering to, sorry.
No, I think that's what I was asking is if you and Karen were comfortable with Thomas's suggestion, is that we stick with what the state order says, but work diligently to press the state for more information on what the strict precautions would be, and then get that information out to businesses as soon as possible so that when we do have the data to support expansion, that they are ready to go and feel prepared for that. I just want to say real quickly that there's a lot of questions coming in on the group chat. I've tried to jot down a couple themes, but normally in a work session, we don't have questions from the gallery. So April has put up the email to send questions to if your questions aren't answered during this meeting. And then a couple of them I've clumped together and think that we might get to them in further discussion. Okay, the next one is real estate.
Sarah?
Sorry, go ahead.
Sarah, so
Yeah.
This is Scott. I just want to chime in. I'm back. The call that I was on included Eagle County and Pitkin County, Lake, Routt, and Gunnison, and Chaffee counties. Some managers, some public health directors, some other. And I just wanted to let everybody know that from a short-term rental perspective, Eagle County had been alluding to the fact that they may be modifying some of their restrictions around short-term lodging, and they confirmed that that is their intent right now, is to close those down in a similar fashion to what we've done in Summit, because again, it's part of their intention to make this a locals phase of their recovery effort, and so they are again sort of following in line with what we're doing. With regards to that, Routt County has extended their short-term rental or short-term lodging prohibition through the end of May as well. Pitkin County has already, again, extended theirs as well. And so I just wanted to fill in that gap in case that discussion had already happened around our short-term rental piece. But that does seem to be pretty consistent with what the other resort region counties are doing with, again, this idea that we want to we don't want to send the message that we're open for visits and for tourism at this stage, because we're just not prepared to be able to take on that influx of new people.
And Scott, I'll just add on, our governor at his 1:30 press conference did say, he did talk about travel specifically, and that it really needs to be limited. He even mentioned recreating within 10 miles of your home. He gave that specifically today. And then also just spending it with your household. And so I think the governor is really supportive of this travel not happening from county to county. And I think we have support on that. So thanks so much to hear what these other counties are doing, especially as we look at them as competitors or whatnot, because people have a choice, right? Are they going to go to Steamboat or come to Summit County, et cetera?
Okay, so Scott, just in an effort to be as transparent as possible, we're just going through every single one of the items and then giving the commissioners a chance to comment or express concerns if they have any. So the next one is real estate agents can conduct showings in person, but open houses are prohibited. I did see some recommendations from, I think they were sent by Dana Cottrell around some language that it more provides clarification on this than changes it significantly. And it sounds like the Real Estate Association is asking the state to clarify the language similarly. So not sure if the commissioners saw that or the attorneys did, but again, it didn't seem like it really changed the basics of what we're saying here. It was just a little more clarification. Concerns or comments from the board?
It's great to have clarification for all types of businesses because one sentence means something different to different people.
Yeah, and I actually wanted to add to this one that face coverings would be required for the in-person showings. And I know that she also asked, and this might have been on her clarifying email, if they could do virtual open homes. So Seth, one of our EH specialists who's been working with the Real Estate Association closely over the past several weeks, is going to take the lead on communicating with them on what the guidance is.
Yeah, I took the virtual open house as just basically the agent is showing it, say maybe on Facebook Live or something like that. But I think that's fine and great idea on the mask. So thanks, SAR, for working with us.
Okay, so this next one, I got a lot of feedback on this one. Childcare services will be open with strict precautions to prevent transmission of the virus. So just for the commissioner's sake, and Elizabeth was on a number of these emails, but most of the concerns, well, we're getting concerns from childcare providers and from people whose children would then go into childcare. The childcare providers, their phones started ringing off the hook as soon as this was announced yesterday, and they're feeling a little panicked about, we're all having trouble social distancing, but being able to do that with little tiny people is incredibly difficult, if not impossible. So I think there's a lot of concern about how to do that safely, and then also concern about having the time to implement some of the changes. And again, we haven't gotten the strict precautions yet from the state. So there was one suggestion or request from Lucinda Burns that we set that one out a little bit further than the 27th so that the centers and childcare providers can have some time to make sure that what they're doing is safe and appropriate. We want to be able to reassure those providers that they're kept safe, and as well as obviously children and families who are utilizing daycare as things open up and people go back to work. So thoughts or concerns or questions about that?
Sarah, I think that tying into that in terms of the idea of pushing it out perhaps a little further, again, my understanding in terms of the offices being sort of reopened under the governor's safer at home measure would be a May 4th date. And so it might make sense that that we look at May the 4th for childcare. That gives them a little bit of extra time. And so maybe that's a way for us to move that forward.
My suggestion was going to be the week of the 11th. I just don't think we have enough time to get that all set up. I'd be interested I've spoken to a number of our child care center directors today, but I feel like May 11th, that week would work a little bit better in order for us to decide what's appropriate. They're going to need to talk to their boards and also rewrite their own rules. A number of parents, yes, it's for the majority of working families, working parents, but we have some people that are in a situation where they can send their kids to childcare so that they can recreate on their own or exercise, etc. And I think we need to be careful, or those centers, someone understand, is this childcare just for the people that are actually working right then? essential businesses or the workforce that's happening, or is this just childcare open in general? I don't think we have enough time. So I think we should endeavor for May 11th and work closely with those centers.
This is Thomas. I agree with Elizabeth's observations and will point out the obvious. We can't order them open. These are nonprofit childcare centers that are run by boards, and it's going to be the boards of those childcare centers that are going to have to ultimately decide what they can and are willing to do or not.
I agree with that, but I think when we allow it, it opens the floodgates of people wanting to utilize it and just puts a lot of pressure on them. And if we say they can open and we haven't given them adequate time to prepare, what I've been hearing from the centers is that it's just incredibly stressful to try to operationalize that and meet the needs of families in the community while following precautions that we don't even know what they are yet. So, but I did reiterate, Thomas, to them that just because you're allowed to open doesn't mean that you have to open. But, just like every business, it's a very difficult decision to make when people need their service and they need the revenue. So.
And we're going to be on the flip side also, where we're going to have businesses that are going to be reopening beginning April 27th. And if some of those employers or employees need childcare between April 27th and maybe whenever they reopen. So there's two sides to this. So I would hope that employers across the county would remain flexible, just like I know we will at Summit County government, in regards to our own employees in childcare and how that's working.
I think it's important also to mention that several of our childcare providers might also be in that vulnerable population. And so it really is up to their discretion whether they choose to open or not. And we want to make sure that they're protecting their staff or themselves if they're a home provider, if they are in that vulnerable population.
I also just want to mention, I assume the board knows this, but perhaps not. And just for the public to know that we have a dedicated person in our environmental health department and a dedicated nurse from our public health department that are providing technical assistance and have been and will continue to provide technical assistance to the child care centers and any child care providers so that they don't feel like they're just hanging out there on their own without any support. Okay, the next one is elective medical and dental procedures are allowed with strict precautions. Again, we have no idea what the strict precautions are.
Well, certainly it has a lot to do with PPE, and I think that most of these businesses are very familiar with utilizing that personal protective equipment.
And I think people, they call it elective. But I think the governor made the point yesterday, and as someone who has an elective issue that needs to be addressed, if you're in pain and you can't get that need met, then it's pretty brutal. So if I ever had a vote, I would vote for that.
Yeah, Sarah lobbied the governor's office hard for this one, so she could have some stuff done.
I've been waiting my turn for that too.
Yeah,
have you?
Car needs some hardware in. I know we have a number of people across the county that need some new ACLs, and it is kind of wild. To think that these surgeries are called elective when it's a matter of people walking. I mean, even the heart surgery I had is considered elective, which is wild to me. And so I think, Amy, that we trust our medical providers up here, and they're going to be doing what's best and being extremely cautious in this. And they're going to have a phase in, but I'm fine with that reopening.
They also have access to PPE that they need. So, yeah.
And just to, from a community feedback perspective, we've gotten only support for that one. I haven't had a single person express concern about the medical and dental. Okay, and Karen and Thomas, hearing nothing? Well, actually, Karen, gotta get some fixed.
Yeah,
okay with that.
This one seems pretty obvious. I mean, these are medical experts that know how to do things right. But I thought I'd throw this one in because it doesn't quite fit in the category, but close. And that is salons and personal services. And these people are telling me that they have strict requirements for sanitation, et cetera. And they can't do the social distancing just like you can't in a dental chair, but it seems like that is valid, that they could operate safely in a salon or other personal services. I don't know what all there is out there, massage, I don't know. But it seems like there's a lot of the salon type services that I think could fit into this category of being able to operate safely.
Yeah,
we did get sorry, Amy, we did get a comment on the group chat, which is really helpful, from Ro Mayberry, that the Department of Regulatory Agencies, DORA, is working on safety regulations to ensure safe protocols for massage therapists and hair industries that they expect to implement on the April 27th date in an effort to safely reopen these service sectors. I think this is a tough one because you are in close proximity, but I know that section of our community is particularly fragile to this economic shutdown. And I've gotten pleas from many folks who provide salon services and those other types of things that are really kind of desperate to get back to work. And many of them have good ideas about how to protect themselves and the public. But this is a tough one. I've also gotten plenty of feedback, even from hairstylists who say, I'm a hairstylist and it's not safe to open. We can't do social distancing. So that's been in the minority of the comments that I've gotten back. But, you know, Amy, I think your recommendation on this, is the personal services included under elective medical and dental? That's a different.
No, it's separate category, so it's further down on our list, but we can certainly talk about it now. And I think we kind of put under consideration for the recommendation because we were really waiting for the definition of what was considered personal services. And I know that DORA is coming out with some recommendations, but and hopefully those align with what CDPHE is going to be putting out as their strict precautions, because we want to make sure that we're reviewing those and making sure that that's what makes sense for us here. And I'm hopeful that that also includes face coverings for both the patron and the person providing the personal service. So I think we're still waiting to have that entire list of what the personal services mean, but I do think that, of course, after reviewing those strict precautions, I believe that these services could take place.
So just a couple of things on that. In Governor Polis's press conference in the Q&A section at 3:29, so most people were already on this call, he did specifically answer a question about that he plans to release that information this weekend. It could be Friday, but most likely this weekend, which of course is last minute. But someone was asking him, why is it okay to go get your hair done? You can't be at a restaurant, etc. And he went into a pretty lengthy explanation about one-to-one services, that he was supportive of one-to-one services, meaning one provider is servicing one person at the same time versus a restaurant. You could have, say, 20 employees and 60 patrons at the same time, etc. So I would be in support of our salons and personal services here opening up. We might need a few more days, say until May 1st, which was one date that was originally thrown around in the governor's first press conference. But I feel like May 1st is doable and can happen. I did hear from the owner, Valerie Connolly of Southern Exposure, which is one of the largest salons in Summit County, meaning the most number of stylists at one time, square footage, etc. So I did spend a long time talking to her. She had a number of different suggestions and was willing to submit a document and all sorts of things like that. But then I also know my own provider pretty much works alone all the time and is on her own often. And so that's a different sort of situation. So I think we're really going to have to structure it for the individual business. But I'm supportive of the May 1 date for us trying to get personal services up and going.
Yeah, that seems reasonable to me too. And I think we can have those businesses fill out the social distancing protocol that we're talking about, and hopefully getting up online by the end of the week, so that we're accommodating those that have more people in their business providing the service. Maybe they even need to stagger their appointments in a way that they're maintaining that social distancing of 6 feet.
I think the majority of the questions that I got about personal services is what falls under that category. So I'm hopeful that the state will give us more direction on that, because I got lots of emails from people saying, is this a personal service? Is this a personal service? And I don't know the answer. Okay, any more comments on that one?
This is Thomas. This is not my area of expertise at all. But if I am a hairstylist, or if I work for a business that provides personal services, but I'm somehow highly vulnerable because I've got a respiratory condition or something like that, would there be anything that we could do in our order that would provide some ability for an employee to go, I'm compromised, and I I want an ability to not have to report to work?
I think that sounds like a Jeff question about whether we're allowed to legislate that.
Thomas, could you give me another chance at that? I didn't quite hear the whole question.
Busted, Jeff.
If I work for a business that provides personal services, and the business wants to reopen with, as the governor was describing, one-to-one service, but I'm an individual that is compromised because I have a respiratory condition, or I have diabetes, or some other condition that makes me more vulnerable to the coronavirus. Is there anything that can be done to allow that person to not have to report to work? That's the one thing that I can envision, where somebody is being told, yep, our shop is reopening, but the person is worried that they're highly compromised and is scared to come back to work.
Right. I think that would be more of a personnel issue for the employee of that business. And, you know, they would have to file for an accommodation or other relief under the policies of that employer. I don't see us necessarily getting in the middle of that. So, yeah, I would see it more as a, you know, a disability question.
Well,
Okay.
in the very beginning of what we're looking at is that sick people and people with underlying health conditions must stay home as much as possible. But it gets back to that. It's not just those, it's all kinds of essential employees, construction workers. I think there are a lot out there who may be feeling sick, but are going to work because they're desperate to get that paycheck. And I don't know what we can do about that except messaging to our community to keep your family safe and stay at home.
Yeah, I think that we just need to realize that as we move forward, whether it's an employer or whether it's an employee, these are the kinds of questions that are likely to come our way. So we should think about and be prepared with our answers and what we can, you know, tell people, what kind of guidance we can give, and and then where we simply need to limit ourselves.
Any more discussion or question on that piece?
Yeah, I guess my question, will this really come from Dora for those businesses, say the salons or spas, etc., or is it us, or what does that look like? Because I know we just have so many questions, and want to try to be clear to those providers. If the state's saying April 27th, if we're saying May 1st, really who they're listening to.
Yeah, I think that's tough. And I know the sheriff is on the line. I mean, all of these pieces, the other question that we keep getting is, what do you do when someone doesn't comply with the order? And the more people we have coming in, the more tweaks we make, the more difficult answering that question becomes. And I think the governor did a good job of answering that, which is that we really have just been seeing people doing the right thing and being responsible. And so, I mean, I think if it's a licensing issue, then it's a DORA thing.
Yeah, I guess not so much about enforcement. That wasn't my question. I just think I understand we're not making decisions today, but we haven't talked about when we're making decisions. And so instead, how can we clearly communicate to those providers? Should you guys plan Summit County April 27th or May 1 to be open? That's more my question. With forthcoming details.
I think, if we know that these guidelines aren't going to be coming out till the end of the week or next week, I think, extending it to the May 1st or May 4th or May 11th, depending on which pieces of the order that we're talking about, makes more sense. It gives us time here locally to look at what the recommendations are coming out of CDPHE and DORA. So certainly if it's coming out of DORA, whoever's licensed under DORA is required to follow their guidance, but then we might have guidance that's even more strict than that, because that's what makes sense for us here, that they would also need to be following. But until we see those recommendations, we're not really going to know what we need to implement to feel like it's a safe situation here.
Okay, so my vote is that I understand we might not see them till Friday, maybe Saturday, but that we allow those sort of services to begin on May 1st, which is a Friday, for us to message out and communicate to those folks. Because I think it's tough because the state announced that begins on April 27th. And so immediately places started getting booked up with the understanding that they might have to make adjustments and whatnot. I think May 1st seems completely fair on personal services.
Okay, so we're not voting, but do Karen and Thomas want to provide input on that?
I think that's time to be able to get all of this in place. If we do it over the weekend and throw it out Monday morning, I don't think it's reasonable.
Yeah, I think that, the key thing that we desperately need guidance from the state on a number of these things. And so when we actually get that, our ability to figure it out, our ability to then communicate it to the businesses with a reasonable expectation of them being able to comply with it. I mean, this is going to be a moving target, but I would agree with Elizabeth that on this one, May 1st is the best target date that I could come up with.
This also gives us time to collect more data on the testing that we're currently implementing this week and next week.
The question I would have, does that mean then that the public health order, the local public health order, is going to be amended a second time, given guidance from DORA and from the governor?
This is Thomas, perhaps, but we've tried to write our local public health orders so that they accommodate further guidance that comes from the state. I don't know if we'll be able to pull that off with this one or not, but that's something that we'll be working on in the next few days. Hopefully guidance comes sooner than later from the state, and it's logical and we can quickly understand it, communicate it, and have businesses implement it.
Okay, move on to the next one. Restaurants and bars can continue to offer takeout and delivery. Dine-in services are not allowed.
No different than what we've been doing.
Right. Any concerns or questions from any of the commissioners on that?
I guess the only suggestion is that we want to be letting restaurants know that the next step will be allowing people to come in small numbers, but we're still at the curbside for now.
Right.
The State Restaurant Association is doing a lot of work about that next phase and how that gets implemented slowly, et cetera. So they've really taken the lead. And I think that's helpful on our end because I think they're going to help the state provide that roadmap for restaurants reopening.
Yeah, this is definitely considered a higher risk establishment for disease transmission. So it is really important to take the time to really figure out what those guidelines will be going forward.
Okay, non-essential office workplaces can open May 4th with up to 50% of staffing. Employers are encouraged to telecommute as much as possible, and workers must maintain a 6-foot distance while at work. The main questions I've gotten from the public about that are for offices that are small and the 50% reduction. So if you have 4 people in an office and you can be 6 feet apart, do you still have to reduce your workforce in the office by 50%? I think the answer that I got legally is that's what the order says from the governor. So concerns or questions about that one?
No, that's how I interpreted it. I mean, if you have 2 people in the office, only one can be there at a time. I guess we should, though, state unrelated people, right? People that are from separate households.
Yeah, and I think, again, we would have these establishments fill out the social distancing protocol because it also depends on the square footage. Because 50% might be 3 people, but the square footage of their office is tiny, so they can't maintain the 6 feet separation.
Okay.
That one seems a little arbitrary, but I guess at this point we just need to follow what the state is saying.
Okay. Next is car sales are allowed in person as long as they are scheduled by the dealership to prevent gatherings of more than 10 people. Everyone
Again,
good
I
with
would
that
also,
one?
I would like to add face covering required to that as well.
It's a great idea.
Yeah, I was thinking the same thing. And then I'm thinking we're also expecting that of restaurants and bars and some of these others. I don't know if we need to be saying it every sentence, but face coverings are in general required still, aren't they, by the state?
They're highly recommended, but I think when people are going into establishments, we should require them. So we could put those under the general public measures along with, still encouraging to stay home without, unless you absolutely necessarily need to go out. Sick people need not to go out, avoid unnecessary travel. So we could add it to the overarching measures, if that makes more sense.
Yeah,
Well, they're required essential workers.
right. I thought police changed it last Friday that at grocery stores it was a requirement.
So what we're talking about is actually patrons also having to wear them. So not just those who are employers, but also
I have seen
or
some
employees, but
restaurant-
yeah.
Yeah, I've seen restaurant employees for takeout that have not had them on, and I wasn't sure what the rule was on that. I think it just goes to what the governor continued to say today. Testing is not enough to reopen. It's a combination of all of these things, wearing the mask, social distancing, etc. So I guess we can't require it, but we can say it's highly.
Well, we can require it.
Yeah.
Pitkin just did that today. I don't know, I can't remember what Eagles says, but we certainly can require it for people going into establishments, maybe not necessarily out in public where they can maintain their 6 feet of separation.
Well, and we're going to talk about transportation soon, but we're going to require that if you get on public transportation, you have to be wearing a mask or you're denied entrance to the vehicle.
I like the idea of having it in general, just people out hiking, biking, walking, they have to pass each other. And if they're not around someone, they can have their face covering down. But when they are close to someone, they should have it up, no matter what they're doing if they're around other people.
Okay, so we can look at language for that and just the general pieces. Next one, car rentals are allowed. That stays the same. Any comments on that? Assuming that's fine. The next one, some stage main line will resume operations with buses limited to fewer than 10 passengers. Paratransit services will continue for people who need transportation to work and essential services. All riders will be required to wear facial coverings. I will say, I know Bentley's folks have been working with environmental health quite a bit ever since we closed public transportation to better understand sort of what we can do to keep drivers and patrons safe. So I feel like those guys have done a lot of good work. Any concerns or questions on that one?
Maybe for Bentley, could you just describe what the main lines are? And if we'll also be running any of our commuter routes? And then what do we do if there's more than 10 people at a stop? Who makes that determination?
Sure. So our system is effectively a commuter route or a commuter system to begin with. It's a fixed route system that provides commuter transportation. It's not a local transit service, which means we don't make laps through the towns that we serve. So it's a commuter route to begin with. Our main lines are those that go basically that follow each one of the basins. So we have the main line runs along the Blue River, and we have another main line that runs along the Snake. So each one of those will be the ones that we are going to be running, and they provide service to a lot of the kind of local transit dependent stops, such as the grocery stores, Walmart, Target. Those are the areas that are being served. So those are the lines that we will be running, and we intend to initially, until we have a full understanding of the demand, we'll probably be running those on a 2-hour service. And we'll be running again along the Snake River and up the Blue River to serve customers and patrons along those lines. With regard to the any kind of protective equipment, we do have the ability, and I have had conversations with our transit director who has access to information across the country that we do have the ability to manage all of the protective equipment and protective gear for both our drivers, and we can demand it of passengers. So that is pretty well covered. With regard to overflow, the fact that we have been running an on-demand service right now gives us a lot of flexibility in tracking our routes. So if we find that there is at a particular stop over 10 people on a routine or regular basis, we'll be following that up with a smaller vehicle to pick up that overflow. We don't want to leave anybody stranded or leave anybody standing at a stop. So we will track those routes pretty closely, and if need be, we'll be providing follow-up transit services at stops that have demands that exceed the 10 for a bus.
And then the hours, will they be reduced? I mean,
The hours will be consistent with what we've been running right now. We're going to go ahead and keep 7 to 7.
okay.
And so we'll run the regular bus service 7 to 7 and the on-demand service during that same period of time.
Any other questions or concerns on that one? Okay, the next one is places of worship are allowed to open as long as people maintain a 6-foot distance and gatherings are limited to fewer than 10 people at a time.
And they're wearing face masks.
Yes, I mean, I guess that's my point. If we're, instead of putting it in every one of these, maybe we should put it in the broad-based overarching measures. I do think most of our places of worship have already been making accommodations and adaptations to doing drive-through services and or virtual services. So I don't think this is a huge change.
We do have a question in the chat about no more than 10. And again, that's following the governor's guidelines of groups. And we cannot go beyond that. That's following the state guidelines. So we could only be more restrictive, not less restrictive on that.
Thanks, Elizabeth. This one, we have gotten endless comments, both in favor and strongly opposed. Second homeowners cannot visit their homes unless it's necessary for maintenance or other essential activities. And that just goes again to just the surges of people that come in and how hard that is to navigate safely. Any questions or concerns on that one?
And I'll just comment that that's essentially the approach that we've been taking with the current public health order. And I will say that was part of the conversation I had with the other counties earlier this afternoon. And for the most part, they are doing something very similar in terms of discouraging second homeowners from being within their communities, very much the way that we are.
Okay, the next one is trailhead parking will be limited and parking enforcement will continue. Any comments or questions on that one, concerns? Okay, and then STRs, we're already changed. Obviously, we've gotten a lot of questions and opinions about that. One comment that I do think is worth mentioning is that those businesses need as much advance notice as they can to start booking people. And that one's really, it's just a hard one, I think, for all of us because we understand how many people are impacted by this. But again, you know, we got to use data to drive those decisions, but also be forward thinking enough that we can give people a chance to rebuild that business as we go forward. Any questions or comments on that one? I think that's all of them.
So
Jeff,
on
or Amy, did I...
On the STRs, I do think we should continue to have ongoing community conversations about it. I understand that we are doing the best with the knowledge we have and feel that May 31, but just for those places to plan. I mean, you can guess the majority of the emails I've received are related to both STRs, which they're saying Eagle County is doing, and all the tourists are going to Eagle County. Whether that's true or not, we will see, but they're mostly based about both STRs and the second homeowners part. And I don't know if Jeff is on, if he could explain more about second homeowners. I guess I'm trying to understand I guess I understand it, but if we could explain it more publicly, since we have so many people on this call, the rationale behind the second homeowner piece.
You want that to come from Jeff or Amy? Are you meaning like a public health?
It doesn't, it doesn't matter. I guess both, because there's the public health aspect, and then there's also the legal aspect that we continue to receive a lot of questions on.
Right. So sort of.
Amy, you want to start with the public health?
Yeah, I think that, you know, this really plays into the governor's advice to really avoid unnecessary travel, to recreate within, you know, within close proximity of your, within your resident, you know, primary residence. I do think that it makes sense that second homeowners are coming to our community to check on their home, to make sure pipes aren't freezing, et cetera, get things ready for the next season. And so I do think it is it's a pretty gray area. And I don't think that, you know, our biggest worry is that people will be coming from areas where there are hotspots or epicenters of disease. And it's, again, it's this stepped in approach of opening, or I shouldn't say opening, but phasing into a new normal of what life will be with this illness within our community. And so I think it just goes back to really focusing on our current residents and how we can accommodate these steps of reopening.
And this is Jeff. I'd just jump in on what Amy said previously, or in previous meetings, I guess, that you know, we have a limited supply of medical facilities, of PPEs, and we obviously have a very substantial altitude issue. So, you know, there's certainly a rational basis for this restriction, and that, you know, under the public health statutes, you know, the public health officers and officials of both the county and the state have full authority to prohibit second homeowners from visiting their second residences or third or whatever they might be. And, you know, there's some, as Amy mentioned, there is some leeway that's been granted that's reasonable to allow people to make sure that their homes are not at risk of damage or whatever, and they can engage in necessary travel as defined by the state order. But beyond that, they are lawfully prohibited from coming here.
Okay, so that was everything I had on my list, I think. What other questions or areas of support could we provide to the commissioners?
Well, we're going to need more updates as the state does their updating. So we can make sure we have good final wording.
So where are we on these small gym type businesses? I know that I think the state order closed gyms, but I believe the state definition is for a larger facility that serves a number of people. And we have a lot of places here in Summit County that serve maybe 5 people in a bar class, or, you know, 10 adults in a dance class, something like that. And so how would we differ from the state on that? Or is the state looking, and I understand we might not know what the state's doing, but if they're looking to change these guidelines at all in terms of yoga studios, things like that, where maybe you have, you could restrict it to less than 10 people?
Well, are you talking about what's currently being prohibited, or what might be prohibited or allowed in the future?
What's going to be allowed on April 27th.
Yeah, we're still waiting on that. I think the only thing I've seen or heard about that was that personal trainers might be allowed, but that's the only reference I recall. I mean, otherwise, though, that's in the context of the current order, which, you know, specifically calls out that health clubs, fitness and exercise gyms, and similar facilities, and any of the other businesses that are similar to that are required to be closed. So they are specifically prohibited in the current state order.
then youth sports, I wasn't sure how that was being addressed. If there's groups that are less than 10, if that's allowed right now. I know I've heard from both baseball, soccer, etc.
Amy, do you have anything on that one? I assume that if the group size is greater than 10 or greater, that would be not allowed as a gathering. But any other insight with regards to youth sports?
Yeah, sorry. I was just trying to open my document here. So it's really right now in the current order, it's because there is a higher epidemiological evidence of risk of transmission just among this population, you know, and the inability to really limit the gathering size, the following establishments will be closed, and it includes any recreation, playgrounds, public spaces, sporting events. Hasn't been directly addressed in the order. And I know that we are currently looking at that with our staff to see what might be possible to start allowing for this summer for rec leagues and so forth. But they are considered a high risk of transmission. We don't really know what role youth play in transmission of this illness. We do know that they don't typically get severely ill, but they certainly can be passing it on to those that are most vulnerable in our population. So I think that's something that we need to consider to continue to research and be able to come up with some guidelines.
Did the state give a specific date that that's closed through?
No, but I do know that at least for spring sports, most of them have all been canceled. So this would be for summer sports. And this goes along with summer camps and everything else that I think all that information will be coming out in the next couple of weeks, and more information from the state, as well as what we can put together as a staff for what our recommendations would be.
Yeah, I think, Amy, I think part of the issue is that some of those teams, not school-based sports, but other sports are starting to sort of gear up for practice and whatnot right about now. And so, again, I just don't know that we have a firm answer with regards to that from state guidance, but I think that right now the overriding concern would be if it's a gathering greater than 10, it wouldn't be allowed. And maybe there are ways that, again, smaller groups are able to practice or work out together in some fashion in an appropriate facility or out of doors. But so more to come, I think, from us on that one. I don't know that we have a solid answer yet.
Sure. And, you know, what's most important to understand is that we still need to maintain that 6 feet of distance. And so, you know, depending on the type of sport, soccer, probably not, because you're in close contact. So it really depends on the sport that we're talking about, because you still do need to maintain that 6 feet of separation.
Yeah, I love that, Amy. That just brought to mind my daughter playing, third grade Optimus soccer, and the entire team is one amoeba that's running around the field together, all of which are within 6 feet of one another. So.
Yeah, there's not really social distancing in T-ball, is there?
Well, and I'm thinking of some more informal, like Frisbee games, where you could have 9 people playing Frisbee, but is that Frisbee a problem?
Right. They're all touching the Frisbee. They could play in rubber gloves.
Yeah, I think this was more specific that we have organized rec leagues, not through our towns, but independent, like Scott said, sports organizations that are trying to figure out which direction to go, because maybe they play teams in Denver or whatnot, and they're already gearing up for different things.
All right, well,
Okay.
more to come on that one. Other questions, other areas that we didn't hit? Elizabeth, I know you had a list, and I think we've gone through a bunch of that, but are there other things that are still on that list of questions or themes that we've been hearing?
I guess the main one is, as we well, since this was not a decision-making meeting and instead just a conversation, when will we, as the Board of Health or Amy, actually make decisions or write a new public health order that has to do with all of these new things that are being recommended from the state? And then also, there have been a lot of questions about the measurement or the markers or the criteria. And Amy, that's probably in your wheelhouse. And I understand if we don't have that today, but hopefully in the next few days, we'll be able to tell our community, hey, this is how we know that we're meeting these certain things to then move to the next point, or if we feel comfortable doing it.
Yeah, let me take the first question first, and then I'll turn it over to Amy to answer your second question. So the attorney's office is working with Amy, obviously taking direction and feedback from what the board said today, and they're drafting that newest public health order. Again, the question of timing is a real challenging one, only because we're waiting on, again, some of the details and guidance from the governor's order. Our hope was to have that a draft of what that public health order looks like by the end of the day tomorrow, or first of the morning on Friday. And we'll see how close we can get to those deadlines, or how solid of a draft it can be, how many pieces are missing because of the lack of information from the state level. But as soon as we can, we would want to get that information out. And then, of course, we can share it with the board, and Amy can implement it. We want to get it out sooner rather than later, obviously, so folks have more opportunity to plan for it and prepare for it. But understand we're sort of under the gun in terms of getting information from all of the other sources. So I hope that answers that question. And then Amy, if you want to take the other.
Yeah, we're working on the data that we currently have regarding hospitalizations, and certainly the testing that we have going forward this week. But we can definitely put some more information regarding why we're able to move and take this small step forward. But what's important to kind of understand and keep emphasizing is that, this is a fluctuating phasing in and possibly phasing back out approach. And if we do end up seeing, an inability to contain the illness based on the data, the criteria overwhelming the health system, et cetera, then we will need to tighten things back up. And hopefully we won't get into that place. And I think that this very, very concerted and logical stepwise approach, small steps, will allow us to, maintain a level where we're not overwhelming our health system, most importantly.
And the other comment that I'll make, just for everybody, we are bumping up our Zoom webinar capacity to 500. So for our upcoming meetings, we'll go from 100 to 500. So hopefully that will cover our needs, but we'll see. So just a FYI for everybody. Anything else, Elizabeth, Karn, or Thomas?
One item that we haven't covered, it fits in somewhere, physical therapy. I don't know if that's what definition that fits under: medical services, personal services, but it's something that we should have.
That's a tough one. I was wondering that myself.
I think they've actually already been classified as an essential service. I know many of them did close down and then ended up doing telehealth services. But we did, I think, classify them as an essential service because it was important for people to be able to get their mobility back after surgeries and so forth. So they've been able to be practicing all along.
Okay. Thomas, anything else?
Nope.
Okay. All right. Thank you, Sarah, for taking the lead and walking through this meeting. And Amy, thank you very much for everything that you're doing. Everybody really from the county that's doing all the stuff they're doing. And commissioners, thanks for your comments today. It's very helpful as public health and staff and the attorney's office work to draft up that public health order. So this has been, I think, very helpful for us as well. So with nothing else, I guess, Karn, if you want to shut her down, you're welcome to do that.
Sure, and I wanted to do it also a thank you to Lori and April, who are allowing all this to happen for us. And with that, I'd say we are adjourned.